Let's turn our attention to healthcare because this week, the American Association of Nurse Practitioners are in town. They've got some meetings that are taking place. Their headquarters is in Texas, but they're actually in D.C. And there are a lot of things they want to talk about and get some sort of focus on what Congress needs to be doing to work on it. As we mentioned, there's an ACA suit that's taking place today, but this is much broader than that. Daniel Hebert is with us in the studio, American Association of Nurse Practitioners. He is, and you can tweet, by the way, at AANP_news. David, thanks for coming in.
Good morning. How are you?
So talk about, first of all, for people who don't know, an NP, I guess, is somewhere between an MD and an RN, right?
Well, we prefer to look at the nurse practitioner as a highly qualified individual. And, we try to get away from the issues, the topics like mid-level provider, because nurse practitioners are outstanding providers who really are at the top of their own practice.
Okay, so a nurse practitioner, how many are there? How big as a proportion of healthcare professionals are they?
There are over 270,000 nurse practitioners in this country, and they are in everything from primary care to specialty care, like acute care, orthopedic care, convenient care, and the whole 9 yards.
So, and what role do they fill right now in our healthcare system in this country?
Well, right now, most nurse practitioners are in primary care. They're often family nurse practitioners. Some of them you will find in physician offices. Some of you will find actually practicing on their own. A lot depends upon state law in terms of what they are allowed to do. But nurse practitioners are highly qualified individuals who are master's prepared. A lot of them have doctorates, and they can come out of school and they are prepared to provide primary care. And all the things that you would see a primary care physician do, nurse practitioners are also qualified to perform those procedures.
So your purpose in being in Washington, D.C., obviously there are meetings, but I'm guessing that a part of this is that there's some legislation that you think needs to be addressed by Congress. There are some needs that need to be taken care of. Maybe you could help us through some of those. Like, what is it specifically that you're looking for right now?
Well, right now, one of our chief priorities is allowing nurse practitioners to provide home health care under Medicare. Right now, a physician has to sign the order for a patient to get home health care under Medicare, even though the individual may be receiving their care from a nurse practitioner. Now, to sort of set the stage for this, it's rather ludicrous given the fact that nurse practitioners can prescribe across the 50 states, and yet they can't prescribe home health care. So there are two bills, H.R. 2150 and S-296, which are bipartisan bills allowing nurse practitioners to order home health.
So what's the issue? I mean, usually there's a history behind this kind of prohibition. Is there any sense of why this has been the case, that a physician has to have the sign-off for the home health care?
Well, what we have seen is that since the Social Security Act and since Medicare became of age, we are still getting beyond the very archaic provisions that were in there, 20, 30, 40 years ago. And this is one that we're still trying to get removed. And sometimes it's difficult to catch up to the 21st century. And this is one of those things that essentially there is broad support on Capitol Hill, Democrat, Republican, conservative, and liberal. It's just taking a while to get done, but we're urging Congress to take a look at it and get it done quickly.
David Hebert is with us, the American Association of Nurse Practitioners, a co-author, by the way, of a recent op-ed that was penned by Mr. Hebert, as well as Tommy Thompson, former HHS secretary, and the two of them writing. I just wanted to quote this one place here, saying that primary care professionals are on the front lines of the opioid epidemic. The U.S. is suffering from a severe shortage of primary care professionals. A whopping 80 million Americans lack adequate access to primary care. So when you see the word whopping in an editorial and op-ed, you know it's important. So where's the lack? Where's the problem right now? Where is it that the people are falling through the cracks?
Well, I think if you look at rural areas and underserved urban areas, you see a great unmet need. You're looking at a lot of areas in the country where physicians may choose not to practice, and there may be a nurse practitioner across the street from someone. And under some state laws, they are limited as to what they can do because there are these artificial barriers to practice in state law requiring that a physician supervise or collaborate with them. In fact, these requirements are often just a piece of paper in a drawer. It is a misnomer to think that the physician is somehow looking over the shoulder of the nurse practitioner, when in fact that even when these requirements exist, the physician may be 20 miles away. So these are very expensive artificial requirements. Unfortunately, organized medicine has rallied around keeping these requirements because some of them don't want the competition from nurse practitioners.
All right, so let's get into that specific. Who is arguing in favor of keeping these, if you will, handcuffs, for lack of a better word, on nurse practitioners?
It tends to be state medical societies that have rallied around the issue of prohibiting nurse practitioners from practicing alone. They come under the guise of quality, when in fact the quality of nurse practitioners is quite outstanding. And just to give you a sense, over 22 states have essentially allowed nurse practitioners to practice with full practice authority on their own without a physician. None of these states have gone backwards. In other words, once they've approved full practice authority, no states have gone back and said we're going to require collaboration or supervision.
Again, David Hebert with us, American Association of Nurse Practitioners. I have a couple of tweets that have come in the last few minutes. I just wanted to address it. One of them was, though, from a Dr. MD, who says that I have trained, worked with, and supervised nurse practitioners. They are not physicians. There is a difference in scope of training and education. Independent practice is a mistake. What would be your reaction to that?
Well, that's a fairly typical response we get from some physicians who, frankly, are just concerned about the competition. If you look at the education and training of a nurse practitioner who often has several years of clinical practice compared to a physician who may be still going through their residency, and so it's not an apples to apples comparison. Nurse practitioners are trained in the practice of nursing. Physicians are trained in the practice of medicine. And if there was a problem, you would see states reversing their decision on full practice authority. You would see sky-high rates in malpractice premiums, which you don't. So the fact is that nurse practitioners are safe, and some physicians simply don't want the competition. Having said that, there are lots of nurse practitioners who work with physicians in a very, very cooperative situation where there's mutual respect.
So talk a little bit about, I'm not sure how much you followed the campaign for the presidency thus far. Obviously, politics having to do with healthcare policy, the Medicare for all, and some of the things that have been proposed by some of the Democratic candidates. Does your organization, is it agnostic on these issues, or do you have a specific position that you wanted to get out?
Well, first of all, we are nonpartisan. We don't take a position with respect to any political candidate or any political party. The one thing that we hope that the media will ask these candidates going forward is what is their opinion on primary care with respect to nurse practitioners and their views on full practice authority. There is a huge need out there that is not being met. And you're seeing increasingly a lot of patients, a lot of consumers not only want quality of care, they want convenience. And that's why you're seeing a lot of nurse practitioners in convenient care, whether it's at CVS, Walgreens, Walmart. They want to be able to go and take their child after school to get their sore throat taken care of, or to check on a fever, and then maybe go pick up their other child at soccer practice. They don't want to wait 1 or 2 weeks to get an appointment, oftentimes with a physician. So these are the kinds of cutting edge issues. These are kitchen table issues that a lot of Americans care about.
David, is this an issue? You mentioned Medicare before. Is it specifically related to Medicare and what it will and won't cover, or is this something that is also subject to restrictions because of private health insurance?
Well, they're traditionally just restrictions required by Medicare. Private payers have their own rules. But these are impediments in Medicare. So, for example, in addition to home health, nurse practitioners can't order admission to a nursing home, skilled nursing facilities, or hospice. And again, it's just kind of silly when, in fact, nurse practitioners have been around for over 50 years and are well qualified to make these decisions. The other important point is that nurse practitioners can save the healthcare system money. For example, on home health, if the nurse practitioner can't order it through Medicare, they have to get a physician involved. The physician then bills Medicare and then goes back to the nurse practitioner. And the physician bills at a higher rate under Medicare than the nurse practitioner does.
And last thing, I think I want to emphasize this because you mentioned urban areas and some rural areas. I mean, the essential part of this is to expand the opportunities for people to get health care coverage, right? Not just coverage, but actually health care treatment, because if it is the case that doctors are becoming scarcer in some of these locations, then somebody's got to take their place, right?
Well, that's exactly right. There is a huge unmet need in these rural areas and some urban areas where physicians simply don't want to practice. And nurse practitioners are raring to go, and they're willing and able to take care of these patients. Where are they going to go, to get, this important primary care? And we have seen over the years that access to primary care will save the system money because ultimately patients don't get as sick as they might had they been treated earlier.
David Hebert, I appreciate you coming in the studio. Thank you for joining us on POTUS today. An important discussion. We'll look forward to seeing more of it as we move forward. Thanks so much.
Thank you.
David Hebert is the Chief Executive Officer of the American Association of Nurse Practitioners, joining us to talk a little bit about some of the priorities, meetings that are happening in Washington, D.C., possible legislative solutions, if you will, that Congress can look at. And the Twitter handle is at AANP_news.